Dr. Patel, so much focus has been on the vulnerable older population, but we have new information about the risks to children when it comes to the coronavirus.
You're exactly right. We've really been focusing on the older population, but new studies coming out of China right now, we have new numbers. They looked at over 2,000 suspected cases of this coronavirus in kids and found that, while about 39% of kids had mild to moderate symptoms, 6% had severe illness. I mean, that's a pretty important number. And so that's telling us right now that we can't take our pediatric population lightly, because 40% with mild to moderate symptoms could still absolutely overwhelm our healthcare system. Not to mention, this could be a really big issue in kids who have other diseases.
What should people here in the U.S. know about what they need to do to protect their young children?
When it comes to protecting your young children, we're going to do everything we've already been talking about, including all the basic hygiene and the social distancing, which is clutch right now. I think a lot of people right now are starting to realize that you can have mild to moderate or even no symptoms and still be walking around and spreading this coronavirus to other people. So it's all important for young kids to know and for parents to be really stressing on them.
Top U.S. health officials are now looking at data coming out of Europe showing younger adults can also get extremely sick from the coronavirus. The CDC here at home says out of the 508 novel coronavirus patients in the hospital, 20% of them are ages 20 to 44.
Which is kind of alarming. And, fortunately, the data out of Europe and here, we're still seeing that the most severe cases and the fatalities are still in that older group. But that's not to say that younger people are not at risk. In the same mortality report from the CDC, about half of the people who wound up in the ICU were below the age of 60. These are big numbers. And so not only can this lead to, again, really utilizing our healthcare resources, kind of hitting that max hospital capacity, but also we're seeing reports that people who recover from this illness can still have long-lasting lung damage as well.
We're really seeing this virus hit people in really different ways. You can have a 20-year-old who literally cannot barely breathe, needs to be possibly on a ventilator. Then you can have another person who's showing mild symptoms or no symptoms at all.
So we're absolutely seeing that this virus can hit people in completely different ways. And some of this has to do with them having a pre-existing condition, or some of it has to do with factors we don't really know. I think one thing that's really surprising that came out was the NBA player Donovan Mitchell, who tested positive for coronavirus, 23 years old. He said the scariest thing was that he had no symptoms, and that if he wasn't tested, he would have been possibly walking around and unknowingly spreading the virus. So I think the mere fact that it's hitting people in different ways just tells us that we all have to be extra vigilant right now.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.